Hey there, everybody. My name is Christian Brindle with Brindle Insurance Services. We are a small Medicare insurance agency located just outside of Salt Lake City, Utah. And today I'm going to be talking with you about the Inflation Reduction Act that was recently passed in the government and how it will impact Medicare. So without further ado, let's just jump right into this, and I'm going to break down what I feel like are the most important things for you to know and why it's incredibly great news for Medicare beneficiaries and a huge announcement that we wanted to bring to you today. So the Inflation Reduction Act that was recently passed as of 2022 at the time of this being recorded, we want to talk about how Medicare is impacted. So let's just jump right in. Let's start with 2025. This is probably the change that's getting the most publicity right now in the news and in the media. In 2025, Part D prescription drug plans will have a $2,000 cap on spending. This is incredibly important and very, very good news because in the past, Medicare Part D prescription drug plans never had any maximum out-of-pockets. Now this is the same whether you have an individual Part D prescription drug plan that works with your Medicare supplement plan, or if you have your Part D prescription drug plan included into a Medicare Advantage plan. It doesn't really matter which one it is. It's going to be impacted across the board all around. In the past with Medicare, you had different stages of drug coverage, right? So you had what's known as the initial coverage stage, which was essentially like you're paying a copay. You had what's known as the coverage gap stage, which is also known as the donut hole, where a lot of people on Medicare that take a lot of prescriptions have been impacted by the donut hole over the years because you end up paying a higher cost for prescriptions. At the current time of actually recording this, you end up paying 25% of your prescription retail value when you enter the donut hole. Then you had the final stage, which was known as the catastrophic stage. We actually have full-on videos on the YouTube channel or on our podcast, depending on where you might be watching this, that go into this in far more detail. So if you wanted to know more about that, just go search those videos out and you should be able to find an in-depth explanation of all the different stages of drug coverage. But the point being, Medicare did not have a cap on prescription drug costs. When you got into the catastrophic stage, the final stage, if you ever did get there, if you took enough prescriptions to get you there because it's based on your usage, you were in a situation where you were paying 5% of any Part D prescription, the retail value I mean, up to any limit, right? There's really no cap or no limit onto it as we understand it today. This means that finally, Part D prescription drug plans will all have something in common to where all of them cannot allow you to pay more than $2,000 over the course of the year for your prescriptions. And this is humongous. This is going to make a tremendous difference in a lot of people's lives that have a lot of prescription drug costs. Okay, so that's the first change I wanted to touch on, and that will not take effect until January 1st of 2025. The other thing I wanted to talk with you about was for some specific high-cost medications, individuals will have the option to make payments on them over the course of the year instead of paying an incredibly high copay all at once for a 30-day supply. So that's a big change that we haven't seen before. So that's actually a very positive change as well. You can break up the payments monthly over the course of the year instead of having to pay a large copay for a very expensive prescription right off the bat. So that definitely softens the blow for some of these really expensive prescriptions over the course of the year, okay? Another change that we wanted to touch on is starting in 2024, catastrophic coverage, which like I mentioned is the final stage in the stages of Medicare Part D prescription drug coverage. Catastrophic coverage will go down from 5% of what the retail value is of the medication down to 0%. So I wanted to make sure that you understood this part of it because in 2025, that's when the $2,000 maximum out-of-pocket limit will be enforced on all Part D prescription drug plans on the individual side or on the Medicare Advantage side. However, in 2024, with this change going from 5% down to 0% in the catastrophic coverage section, this will also allow people to have a cap or a limit to what they can pay on their Part D prescription drug plans. So if you ever enter catastrophic prescription drug coverage and you get out of the donut hole stage, you will then not have to pay anything out of pocket for your Part D prescription drug plan. So that is a humongous positive change that we are seeing coming as soon as 2024. Okay. The other thing I wanted to talk about is some changes to insulin. So several years ago, there was an act put into motion that was called the Insulin Senior Savings Program. What the Insulin Senior Savings Program meant was certain individual Part D prescription drug plans or Medicare Advantage plans had the option to opt into the program. And what that means with them opting into the program was select insulins on a select list of insulins, and it's mostly, the large name ones that you probably are familiar with, like Humalog, Trigeo, just different things like that. If the insulin was covered under the plan's formulary, that they would cap the cost of the insulin at $35 for a 30-day supply. This is very important because this is something that's in effect now and has been for several years if you're on a plan that participates in the Insulin Senior Savings Program. The change that we're going to see starting 2023, so just in a few months here, is every single Medicare Part D prescription drug plan or Medicare Advantage plan that offers Part D prescription drug coverage will now be required to participate in this Insulin Senior Savings Program that caps all of the qualified insulins at a 30-day supply, $35 copay for a 30-day supply, regardless of which insurance company it is. The insurance company could always not include the insulin in their formulary, so you have to make sure that the insulin is actually covered under the plan, but as long as it is, they can never charge you more than $35 for a 30-day supply, regardless of the insurance company, regardless of the state you live in, and in some markets and some plans, it might even be less than $35. This also doesn't matter if you're in the donut hole or not. Okay, so that is a massive change to where all plans will be helping out quite a bit with insulin, whereas in the past it was just insurance companies and just plans that wanted to opt in or not. They could make that choice to opt in or not, okay? The last thing I wanted to talk about, and this might get a little bit hairy, so I'm going to do my best to kind of explain it for you. Medicare will start negotiating the cost of drugs. This is the other thing that the news and the media has been covering the most. The two things I think I've heard the most from the news and the media was the $2,000 cap on spending, which is massive, but also that Medicare will start negotiating the price of prescriptions. This is huge because we've all seen it. If you're on Medicare and you take any amount of expensive prescriptions, you might have seen that the cost of a lot of these medications has been out of control for some time. This is not a new problem, but it's better late than never that we're getting some assistance on it from Medicare. So Medicare is going to start negotiating with the drug manufacturers, with the pharmaceutical companies, on the cost of certain prescriptions. And this is kind of how it's going to be formatted. They will begin the negotiations in 2023. However, it will not take effect until 2026. So they're going to begin the process of these negotiations 2023, and over the course of time, they're going to be working through this process. Now, in 2026, they're going to take 10 of the highest cost Part D, as in dog, prescription drugs, and they're going to try to negotiate the retail value of them down. The reason why this matters is because the higher the retail value, a lot of times the more out of pocket it has for you as the Medicare consumer, even if the insurance is paying something, right? If you have a percentage that you have to pay, the higher the retail value, the higher that percentage ends up being for you and what you end up paying out of your pocket, right? So they're going to take 10 of the most expensive Part D, as in dog, prescription drugs, and they're going to negotiate these down. For this next part, I want to explain the difference between Medicare Part D prescriptions, as in dog, and Medicare Part B prescriptions, as in boy. Medicare Part D, as in dog prescriptions, are medications that you have to go to the pharmacy to get filled. It's something that you don't go into a doctor's office for necessarily. You're getting it filled at the pharmacy, you're going home, you're taking it on your own. Medicare Part B, as in boy prescription drugs, are high expensive injectables and infusions, those kind of prescriptions normally, that you have to go into a doctor's office, a hospital, a facility of some kind to have administered, and it's not something you can fill at the pharmacy and take on your own. So D is in dog, B is in boy. Understand the difference between those two. That's going to matter in a second here. So the top 10 most expensive prescription drugs are going to be negotiated by Medicare on the cost for the retail value as of 2026. In 2027, 15 new additional prescriptions are going to start being negotiated the cost by Medicare for Part D as in dog. 2028, we will then find a combination of 15 Part B as in boy prescriptions and Part D as in dog prescriptions will begin being negotiated by Medicare to reduce the retail value. This is important because a lot of Medicare Advantage plans will charge a coinsurance for Part B as in boy prescription drugs because it's considered a medical expense and not a prescription expense like Part D as in dog prescriptions are. and a lot of Medicare Advantage plans charge some kind of coinsurance. So if the retail value of those Part B, as in boy, prescriptions goes down, that means the percentage you end up paying as your coinsurance ends up meaning you pay less for those type of prescriptions. So this is great news. Then in 2029, they will have 20 new and additional Part B as in boy and Part D as in dog prescriptions that they will start negotiating the cost of. Meaning that you should end up paying a lot less on your prescriptions overall if you've been hurting with your prescription drug costs in the near future coming soon. That's essentially what this means. So in a nutshell, if prescription drug costs are hurting you on your Medicare plan, there's a great chance that the cost of those will be reduced and you will see a little bit of relief on what you're paying very, very soon. I hope you enjoyed this video. I hope that you found it helpful and educational. If you did, do me a favor. Please drop a like on the video. It helps so many people like you who are on Medicare who need to hear our information find it easier. It helps with the YouTube algorithm if you've ever heard of that before. Make sure to drop a comment below. What do you think about this? Do you feel like this is a long time coming? Do you think this is going to help you a lot in your life? I think it will help out a multitude of different people across the country in so many ways, and I was so pleased to hear about it when I did. Also, make sure to subscribe if you're watching on YouTube. If you are listening to this on a podcast format, make sure to leave us a 5-star review if you found this helpful and encouraging. Thanks so much for watching. Thanks so much for tuning in. We'll be bringing you more updates on this new change as they become available to us, and we'll be bringing you a lot more informational content on what you need to know as the annual election period approaches for Medicare. Thank you, folks. Have a great day. We'll talk with you soon. Bye-bye.